My name is Avinash Rajayab, and I am a respiratory and acute medicine consultant in Northumbria hospitals. And the purpose of this video, to a certain extent, is to give you a feel of what you might be experiencing at home and what we might be expecting you to feel like during the recovery process of COVID-19. I think, first of all, there is certainly a lot of patients who complain of fatigue after the acute illness. The acute illness being exemplified by your stay in hospital and maybe having required oxygen, maybe having required steroid treatment, or maybe even having been on intensive care receiving tight-fitting masks to help you breathe, or even a tube down your throat to help you breathe. Seriously debilitating fatigue is to be expected, but what we hope is that things will improve, and this is going to be a running theme, that time is your biggest ally here. And say about 6 to 8 weeks time things should start feeling back to normal, and during that time you should probably just do what you can, but keep active and do not be frustrated about what you can or can't do. It's quite common to feel very anxious during that time as well as to what the future might bring, because this is a new disease and we're learning a lot about it as we go along, and we certainly know a lot more about it now than we did in March, for example. And we do know, for example, that if you had changes on your x-ray, we do know that it recovers within 6 to 8 weeks, and we're seeing that in our COVID recovery clinics that we've set up in our trust. We do know that sometimes lung function and associated symptoms relating to low lung function recovers as well after that time. I think if you've been on intensive care or even on our respiratory unit receiving the tight-fitting mask to help you breathe, there's a lot of problems that can arise from that in terms of what we call the post-intensive care syndromes, and almost a form of post-trauma disorder. And it's very common to see these things. Your sleep might be disturbed, your concentration might be disturbed as well. And we hope that over time, again, things will just get better. What you have to do is keep active, keep healthy, seek help when appropriate, ask your GP, primary care, ask the consultant who you were discharged under for help, and we're certainly here to provide that if you require it.